Hi, I'm Michelle Rupp, host of AFMC TV. Thank you for joining us. AFMC TV is a place to consider as a healthcare hub. AFMC is a healthcare nonprofit. We specialize in making our lives, businesses, and communities healthy. This space was created to share information with the community. You'll hear from healthcare experts on a broad range of topics. Medical topics like immunizations and telehealth, to lifestyle topics like strengthening a routine or keeping your family hydrated. Our promise to you is to keep you informed in a digital way, providing useful information to you and your family. Again, thank you for joining us and welcome to AFMC TV. About the vaccine. In the next hour, we will
very hard to play. That this video will provide ideas and also make sure
Hello and welcome into this week's edition of AFMC TV. We're so glad you joined us. You know, with Halloween coming up this weekend, we are all things dental today. And joining me this morning is Dr. Lisa Lundy, and dentist extraordinaire. Thank you so much for joining us today.
Thank you for having me.
So I'm curious, we'll start with children first. Do you see pediatric?
I see children, I see all ages.
Okay, yes. You got us all. All right, well then, how early should a child have their first dental visit?
I would recommend parents bring their child for the first visit within 6 months from the time that first tooth appears in the mouth. So I would say when they turn 1 should be a good age. And this visit is mainly for the child to start getting used to coming to the dentist. We try to make it as short as possible. We will polish their teeth. We will apply fluoride, and mainly is to educate the parent on how to take care of those teeth, what to feed their child. We talk about pacifiers, thumb sucking, and what to do, what not to do at an early age. And then after this visit, we do recommend that the parent bring the child every 6 months for their checkups.
You mentioned pacifier and thumb sucking. Could those contribute to a need for braces later on?
Oh, absolutely.
Or not? Okay.
Absolutely.
Okay.
Yes. So that's why it's so important to detect those issues at an early age.
Yeah, for sure. Sometimes we might think, well, they're just baby teeth, right? They're going to fall out. The tooth fairy is going to come. We don't really have to take care of them, but you do.
You definitely do, because we don't want to lose those too early.
Yeah.
They're there for a reason. If we lose them too early, for instance, those baby molars are there to preserve the space for the premolars to come out. So if they come out too early, then that can definitely affect the occlusion.
Definitely.
Yes.
Well, okay, Halloween, I'm sure your favorite time of the year.
My least favorite. I do not like candy.
It's right around the corner. Yeah, and we know children are going to have buckets of candy because no one goes to the house that gives out raisins. We all go to the house that gives out candy bars.
If you give me the option, I will give away toothbrushes.
Okay, there you go.
But realistically, I'm not going to ask the parents, don't give candy to your child.
Right,
That's just not going to happen.
It's not going to happen.
No.
Yeah.
But as far as what to do during Halloween, a few tips is when your child comes home with a bucket full of candy, sort them out. There are some candies that are worse than others. So I would say stay away from anything sticky and hard. I think chocolate, that's a good alternative. Also, a good time to give your child candy would be after a meal. Make sure you brush their teeth afterwards. Don't keep that candy accessible so they're not constantly snacking on it. And the other thing that I would suggest is just donate the extra candy.
Donate it.
Donate it.
That's a great idea.
Yes.
Yeah. Okay. I know my nephew used to he would hide his bag of Halloween candy in his closet behind some clothes so his parents wouldn't find it. And then
I would hide it from my kids.
That's a good idea. What are some, and you kind of touched on this already, but some of those healthy habits that we can begin instilling in our children?
Well, first, just coming to the dentist regularly. That way they don't have that fear. They get used to coming to the dentist. We can educate the parent every time they come in for their checkup. Also brushing their teeth twice a day. in the morning and at night right before bed, and flossing. Children do need to floss. They do sell flossers designed specifically for children.
All right.
And also the diet. Stay away from sugary drinks, juices, and sodas as much as possible.
And talk about what that sugar does to the teeth.
It will make the enamel weaker, and the patient will be more susceptible to decay.
Yeah.
Yes.
And we don't want fillings, and we don't want cavities.
We do not want cavities, no.
We don't want all of that. So, okay, that's how you deal with children. And so now let's kind of just move in the progression of teenagers, adolescents. They've lost their baby teeth. Now they're working with adult teeth. Again, continuing that 6-month regimen.
Yes, absolutely. It is very important to have a good oral hygiene as an adult as well, because there's a lot of oral problems that can come and will make you more at risk of developing some issues like decay, gum disease, and your mouth is part of your body, and there's a lot of issues that happen within your oral cavity that can affect the rest of your body. Like, just to give you an example, if a patient has an infection that developed in the oral cavity, this doesn't happen very often, but it could travel to distant places within your body, like your joints and even your heart.
Oh, wow.
Yes.
Okay. Are you able to detect disease based on the health of the gums?
So when the patient comes for their exam, we have to look at the overall picture. There's a lot of clues that when we look into the patient's mouth, it tells us the overall health of the patient. For instance, if the patient has periodontal disease, and let's say we treat the periodontal disease, but we feel like we cannot get it under control, we have to ask why. We're still dealing with inflammation. Well, the patient could be diabetic and not know it.
Wow.
The patient, we might notice some erosion of the teeth. Why is this happening? Well, the patient could have gastric reflux at night and not know it. The patient might be bulimic. So those are the little things that we have to pay attention to that are connected to your overall health.
That is so fascinating.
Yes,
it's
it is.
not just
your mouth.
your
it's
mouth.
Your whole body. Yes.
It really is. So what do you recommend then for adults? Because I know sometimes it can be very difficult for an adult to come to a dentist, particularly if they haven't been in a really long time. What do you recommend?
The one reason why a lot of adults won't come to the dentist is because they feel anxious and they had a bad experience in the past. So we try to establish a relationship with the patient to make them relax so they know we do care. We understand why you're anxious. We're here to help. So that's the first thing. Just come into the dentist every 6 months. And of course, that could change. There are patients that need to come more often.
Sure.
And depending on the situation. But once they come regularly, make sure you brush your teeth twice a day for 2 minutes, floss your teeth daily. And something very important is the diet, like I mentioned before.
Okay.
Yes.
I've heard it said before that, with anything where our health is concerned, the preventative maintenance, the staying on top of it, you can help address a situation before it becomes a problem.
Oh, yes.
And the same thing holds true.
Yes, absolutely. Just to give you an example, a small cavity. If we find a small cavity, it can very, very easily be fixed by just restoring it with a filling. But if the patient waits too long, it can turn into something more complex like a root canal or an extraction and implant. Same thing with periodontal disease. If patient, if they don't come to the dental office and for their checkups and their treatment, periodontal disease can be very easily treatable at an early stage. But if they wait too long, then their teeth will start getting loose and they can end up losing all of their teeth.
Yeah, and we definitely don't want that.
We don't
That's
want that.
awful.
It's very, very preventable.
Yeah. Okay, last question.
Yes.
What's the best kind of toothpaste and toothbrush to have?
The one that you're going to use correctly.
Okay.
So
That's a good answer.
as far as toothbrushes go, I personally like the electric toothbrush. Not that the manual is bad. If you're gonna use a manual toothbrush, as long as you're using correctly, that's not a problem. The toothpaste, it depends on the patients, because some patients will experience sensitivity, and that means you need a sensitivity toothpaste. Some patients want more whitening, and then you're going to use a whitening toothpaste. But as long as the toothpaste has fluoride, I would say it would depend on the case.
Okay. Mouthwash. I haven't heard you mention mouthwash. Is that really important, or is that just kind of like...
It's an aid.
Okay.
And same thing, it depends on the case.
Okay.
If it's a patient that has a high risk of getting decay, I might recommend one type of mouthwash. If it's a patient that has periodontal disease, then I might recommend something else.
Okay. But it's not necessarily a necessity like brushing twice a day and flossing.
Correct. Manual removal of the plaque, it's essential. Now the mouth rinse, that's an aid. It will help you. Yes.
Okay. All right. Dr. Lindy, tell everybody again where you're located, how we can get in touch with you.
Our office is in West Little Rock,
Okay.
and our address is 36 Rollins Circle, Suite 3. We're located right next to the Thompson Library.
Okay. Fantastic. Thank you so much for joining us today.
Thank you for having me.
Happy early Halloween.
Thank you.
I'll bring you an apple.
Thank you. I'll give you a toothbrush.
Fair enough. Thank you so much for joining us this week. We hope to see you back here next week for more AFMC TV.